Welcome everybody to the CAPHC Patient Safety Collaborative education session at that's happening on a really interesting topic that I'm sure we are going to have some great discussion about. My name is Tracy Wrong, and I'm one of the co-chairs of the collaborative, along with Darlene Bolivar, who is also on the line, and she's from the IWK, and I'm from CHIO. Lisa, is there any touch point that you wanted to make for participants with regard to the technology?
Sure. Just before we get started, so my name is Lisa Stromquist, and I'm the coordinator for quality and patient safety here at CAPHC. And so I'm just going to give you a couple of the technical details before we get started with today's presentation. So all of the lines have come in muted so that we can avoid any background noise for the presenters. And we will have time for questions following the presentation, and I'd encourage you to write those questions in as you think about them during the presentation. So the question panel the question pane is in the control panel on the right-hand side of your screen. So again, just as you think of a question, just jot it down. And also to let you know that all of CAPHC's presentations are recorded and are posted to our Knowledge Exchange network within about a week. And you will receive notification with the link to that recording. And when you get that link, I'd also invite you to look at some of our past presentations, and they cover a broad number of topics. And we announce all of our webinars in a weekly newsletter, CAPHC Presents, and we announce the regular Wednesday webinars and also our monthly patient safety presentations. And just for your information, some of our upcoming presentations are youth engagement and technology, and a three-part series providing an update on the FASD screening toolkit and virtual reality in pediatric neurorehabilitation. So I'm just going to pass the podium back over to Tracy.
Thanks a lot, Lisa. So for those of you that are new to the Patient Safety Collaborative, we've been meeting for many years. Actually, we're one of the first sort of initial CAPHC groups that came together around the topic of patient safety in the pediatric environment. And we have a broad range of topics, and we're also always welcome to hear other suggestions for things that we can be sharing across the pediatric community that would be particularly relevant, and we want to share the good work that's going on out in our world. And so from this, I'll step forward to tell you a little bit about our talk today. Since 2009, the CAPHC has coordinated the work of a multidisciplinary group of pediatric, neonatal, and high-risk maternal transport medicine experts in their efforts to create and disseminate national transport standards for interfacility transport of these high-risk patient populations. This group is now working collaboratively with Accreditation Canada to translate these standards into clinical practice. This session today will provide an overview of the CAPHC Interfacility Transport Committee's journey towards ensuring a safer means of transporting infants, children, and high-risk mothers into the tertiary care setting. Doing the presentation today is Dr. Allan, Medical Director of Pediatric ICU and the transport team at Stollery Children's Hospital in Edmonton, and also Kate Mann, who is the Executive Director at Trauma Association of Canada. Kate and Allan are co-chairs of the CAPHC Interfacility Critical Care Transport Steering Committee, and I welcome them to today's presentation. So I will turn it over to Kate, who will get the show on the road.
Okay, thank you very much, Lisa, and I hope we run into no technical problems. Your introduction is very appropriate. This is definitely a description of a journey towards that transport safety goal that we were striving for the population that we described as being vulnerable and high risk, which was pediatrics, neonates, and high-risk maternal transport. So with that, I'll get underway, and we'll go with our first slide. Cue Allan.
Yeah, if I can get it to move. Interesting.
On to the bottom left-hand corner, to the arrows down there.
You know what? That screen has disappeared. I hate to say it, Lisa. Can you do it from where you are?
Nope.
Just as easy.
So just take your cursor down to the bottom right-hand corner, left-hand corner. Let's go across to the left-hand
There
corner.
you go. You got it. Okay, so the objectives for today are really to describe how this initiative actually began and why and where the journey started. We want to share a little bit about the Transport Practitioner Profile, which is a document that is housed on the Knowledge Exchange Network of CAPHC. And Allan will be sharing the development of the Transport System Design Framework, which remains still a work in progress as part of our pathway. I'm going to describe the journey to find that path, and the way I describe this path is that, in fact, it is not a straight line. It's had many offshoot paths as we found our way, still knowing that where we wanted to end up. So beginning with the end in mind, the pathway has not been straight, but it certainly is still taking us toward our journey and our goal, which was to develop national standards. And we have begun a new part of that by partnering with Accreditation Canada, and we'll share a little bit of that with you. We're going to also look to the future and what knowledge translation is needed and what new opportunities can be created in Canada for the safe transport of this patient population. So just a little bit of background. We all know that care in Canada is regionalized, and critical care for sure for children, neonates, and high-risk obstetrics is, but those populations are definitely not, and getting them to the regionalized care centers in a safe manner is part of the journey that we wanted to describe. So the use of tertiary care, pediatric critical care, the evidence is there that it does reduce patient morbidity and mortality, but we know that it's not available at all times to transport all the at-risk populations. And in fact, less than 5% of EMS transports are pediatric patients. And practitioner skills and experience is definitely variable even within that kind of transport system. So with that in mind, and we all know, for those of us that have worked in pediatrics for many years, just because it's low volume doesn't mean that it doesn't need the same kind of high-level infrastructure surrounding the patient population. But interestingly, there are no Canadian standards that exist to govern safe and effective interfacility transport of this patient population. And so many, and I wouldn't say many, there are some programs in Canada, because of the lack of Canadian standards, have turned to the U.S. standards called CAMES, the Association on Medical Transport System Design, accreditation system that is American. And there are also various components that would evaluate air medical transport, ground transport, communication, and dispatch, very fragmented kind of accreditation system. So that's a little bit of the background. So I said our pathway wasn't straight. This slide is definitely straight. And we're going to talk a little bit about this journey that began in Edmonton in October of 2008 at the CAPHC annual conference. And from there, took a pathway that Allan has put some balloons as we had a bit of a celebration just this past November in 2013, as we had a party with Accreditation Canada to really say, here's what we're thinking, and how does this fit with where we need to go. And we're happy to say that we are now on a different journey collaboratively with Accreditation Canada, still with a goal for having a standards program in place by 2016. And we'll describe a little bit more detail about that as we go along. So, identifying the challenges at the CAPHC annual meeting in October of 2008, the presentation that was being given was about transport systems and the challenges and barriers and enablers. It was focused on children and neonates at the time, and there were 75 of us that were in the room during that presentation, and I still can recall I was sitting halfway down the room on the right-hand side, and Elaine was over my left shoulder about 3 rows back, and as the discussion after the presentation happened in the room, and the passion picked up for, yes, we need to do something to improve the standard of care and the treatment guidelines across Canada and minimize the variation, I could see Elaine getting excited and saying, well, then we're going to do it. And once Elaine gets that kind of focused, then you know that we're not going to let the ball drop on this. So we did identify that we needed the national standards. We knew that there were programs across the country that were mature programs that were probably exceeding minimal standards and achieving excellence, and we wanted to be able to share that knowledge and experience. We wanted to recognize that one size doesn't fit all. There are unique challenges posed by geography in Canada. I think of the remote locations, whether that's north or outports in Newfoundland. And so one model would not fit all, so we needed to understand the complex needs. And even the programs that were mature and were approaching excellence faced many of the same challenges because of the incomplete infrastructure that's in place. And that included things like equipment for the transport setting. And any of you that are on this call, certainly you know what you've had to improvise for your vehicles in order to transport your patient population safely. Having access to transport carriers and team models that kept the skill and knowledge level of the transport personnel at a high level. Those were all things that needed to be sustainable and needed to be addressed. So those were some of the challenges that we identified in 2008 in that room.
Kate, can I just interrupt for one moment? It's Lisa.
Yes.
I'm just wondering if we can ask a question about if any of the people online were at that meeting in 2008.
Oh, that'd be interesting to know. So was there anybody present in 2008? Oh, we're doing a poll.
Going to do a poll.
I'll let you do that one.
Oh, that says neat instead of no. You were there, either yes or neat.
It sounds like a Monty Python skit.
Yeah, the Knights of Neat. So please, everybody, just click your response, yes or no. So I'm just going to close that now and share the results. So 11% of the people were at the, 11% of our participants today were at the meeting, and most of them were not. So just that makes it good for us to know that there's even that many more people interested in what we're doing.
Which is outstanding, yes.
Great. Okay, so from October 2008 to right away after Elaine probably put her feet up for about 2 days, as she called together a small group in December of 2008 to look at establishing a National Transport System Steering Committee that would be comprised of experts to address the issue. And what we wanted was to make sure that there was national representation, that it was multidisciplinary in nature, and that there were multiple team models that were represented, that represented the populations for peds, neonates, obstetrical teams that did a mix of those things. So we knew that there were some teams, Nova Scotia and UB and British Columbia did the high-risk obstetrics, and some teams might only be focused on one of these populations. And we felt it was important to make sure that the non-tertiary care perspective was part of our steering committee. So academic centers that are able to provide specialized services, we know that that significantly improves the outcome and survival of patient populations, but the equitability of getting to such care requires that many patients come from smaller communities and smaller hospitals, and the logistics of each of those transports and the care that's provided really influence how well those patients do in terms of morbidity and mortality. There is strong evidence that a formal transport program and well-educated, well-trained, well-skilled personnel have a positive impact on on outcome. And I think I've touched on this, where the requirements in Canada are very different depending on the geographic location. We recognize that multiple models exist, and there were various agencies that are involved in transport delivery. However, the underlying and common principle was that we had a goal to provide the appropriate disposition and care of such patients as they were being moved across systems. So what we discovered was major variation in practice on how it was done, but that the goal underlying it was the same. And so the goal of providing guidelines to aid in the development and organization of transport programs would include things as access, standards for care, communication, oversight. We wanted to touch on what kind of budget would be needed, what's the administrative support structure, leadership, what kind of personnel and training and education programs. These were all the things that we said we needed to address as a steering committee. So now we go to the spring of 2009, and we did a bit of an environmental scan where we sent out a questionnaire across the country to look at the current standard of practice for this population. And we shared that in May of 2009 in a teleconference. So from there, CAPHC held a webinar, and we talked about setting the stage, that we recognized that there were disparities across the country in how transport was done. We validated common challenges that we had identified. There was recognition of the lack of Canadian standards and the importance of a national focus on doing transport medicine well. Results of the Transport Medicine National Survey were also shared, and we explored potential for collaborative opportunities. So we're a big country, but we're all focused on wanting to do the right thing for this patient population. So things like education and training models, could they be common? Certification standards that were the same for everyone, and transport safety standards that were the same for populations and teams. And then, of course, developing a national transport medicine database to share our outcomes. So in June 2010 in Vancouver, a group got together and narrowed it down to say, so what is it that we actually want to do? And this was the first transport systems working group that morphed into the steering committee. And it identified the goal was we wanted to develop standards for interfacility transport of critically ill newborns, children, and youth. And I have a little asterisk there because we expanded that in the months ahead to say, and that included high-risk maternal transport, or as we would call it, the human incubator sometimes, is the best transport equipment for unborn babies. So with focus on the following two themes, we broke into two smaller working groups. One was called the Practitioner Profile Working Group, and it was to look at what were the training and competencies that were needed by the people that were transporting patients. And the other was the system design, which would include all the things that you see there in terms of infrastructure support around the patients. I'm going to just briefly touch on the Practitioner Profile Working Group. It was interprofessional in nature. We wanted to make sure that we had representative the practicality and the experience of people who did transport. So we had people who represented these professions who actually had participated in transport systems, and as well as administrators who provided the leadership and that kind of infrastructure support, which is how I got on it. So it began by comparing the current status in regions across the country and the existing training programs and competency lists. We looked at anything anybody had in their programs across the country to say, so let's see how people are doing this. Next slide there, Ellen. So where did we start? Well, after looking at all of that, we decided that we would use the document by the British Columbia Infant Transport Team, which was a competency-based document. And we then looked at reviewing that list of competencies, looking at were they relevant for this population, and we expanded, deleted, edited, and we came up with our own document, which is, it seems to me almost anticlimactic when I go from telling you, oh yeah, we did that, and then here you go, because it represented almost 2 years of work to come to this final document, which is has been available on the Knowledge Exchange Network since July of 2012, and it is the competencies profile for interfacility critical care transport. And it is not a long book. It is 43 pages long of easy reading. But if you were looking to say, gee, I wonder what we should know if we're in this business, what we tried to do was look at developing a document that said it is about the team competency. It's not about the RN should have these competencies and the RT. It is about not being prescriptive about how the teams are comprised, but rather what do the teams collectively need to be able to be competent to transport patients in. So it is a really good resource document if you are looking at how do you want to set up your education programs and what should be in them, or how do you evaluate your team performance on this. So I'll just give you a view of the index for it, table of contents, and you can see that we've developed a number of categories. The professional responsibilities really touches probably on, I find the new terminology now is team intelligence. So it's talking about how does the team work effectively together. And then we certainly run through communication as one of the key safety aspects, communication with patients and families, and you will find throughout our document that we cannot separate the patient and the family, so we're always talking that way. And then we run through general health and safety and, of course, systems competencies that you would need. And on the next page, we would look at things like the medications that you should be familiar with. And what we tried to do in designing this profile was that if you are only supporting a certain part of the population, you would pick out the medications and or the things that apply to you. So it is really kind of a pick list when you go through this profile document to say, well, we only do this, so therefore here's the things that apply to us, and you could tailor it to your own use. And then we certainly talk about decision making and the transportation safety in the various types of vehicles. We had a very big focus on air, but we also talked about ground ambulances as well. So I would definitely say if you have not read or seen this document yet, please have a look at it on the Knowledge Exchange Network. We were delighted, I have to say, when Accreditation Canada has referenced this document in their latest EMS standards as something to turn to look at. So it certainly has caught the attention of Accreditation Canada as a significant document in Canada. So with that overview, I'm going to hand over to my esteemed colleague, Allan.
All right, thanks, Kate. So I think Kate's given you a sense as to of these two groups that we'd split up into. What happened to the first group, which is the practitioner profile group, and the good work that they accomplished over a relatively short period of time. The other group, which I was involved in helping to lead, we struggled. It was as you can see there by that first bullet point, we as a bunch of transport experts, multidisciplinary transport experts, we had a sense of where we needed to go in terms of what the ultimate, what ultimately standards would look like for what the system design would be for a transport system. And just to be clear on that, what we were talking about, it's not the individual transport practitioner. This was about everything that exists within a system to help support that individual. What do you need to have a transport system work well and effectively when it comes to moving neonates, children, and high-risk moms? So as I said, we had a sense of where we wanted to be at the end of our journey. Our problem ended up being we really struggled initially with how to get there. There was a lot of time spent through monthly teleconferences. As I said, people from across the country, docs, nurses, administrators, system specialists, and ultimately, one of the first things that we had to get our minds around is, are we trying to design something which is the gold standard? And although the gold standard for a transport system is something that we thought we should all aspire to, ultimately what we ended up kind of coming to the realization of is that having something which is achievable by such a small percentage of the country that may not be practical to implement for the country might not be in the best interest of national standards. So although we did not discount the idea of ultimately coming back to having something which might be kind of a gold, silver, bronze, something that we could aspire to build excellence, not just adequacy, but excellence across the country. We thought, okay, we better make sure that we have achievable goals to begin with. And I think, once again, just to give the background on that, part of the reason for that was that transport, as Kate alluded to, and many of you on this call know, how children are transported across this country is incredibly variable, and it's not, there are committed individuals in every province and territory of this country. A lot of the time it comes down to currently what the resources are available with which they can transport those patients. So bottom line is that we ended up saying, okay, let's try and establish at least some minimal standards that are can be achieved, that are practical, and then we'll come back to the idea maybe later on of actually gold standards or systems of excellence, transport excellence. And I think just so that everyone's on the same page, really what we're talking about, as I said, it's not just, this systems design group was to look at, if you take the individual members of a transport team out of the picture and what it takes to prepare an individual, basically our job as a working group was to look at everything else other than the individual. And I think maybe this is also part of the reason it took us a while to get our act together, is that it was it really was a daunting task. So ultimately, after about 18 months of a lot of good discussion, but still difficulty in moving forward, a cohesive agenda, we ended up, meeting, a bunch of us ended up meeting in Toronto in the summer of 2012. And what we did is we ended up trying to capture on paper, in a one-day face-to-face meeting, exactly everything that we'd been talking about for the previous 18 months that sometimes had been difficult for us to articulate and capture on paper. So this just gives you a sense as to what these standards, these system design standards, were that we were alluding to. We thought it was important to outline, what would be some guiding principles for once again, this is specifically when we're thinking about this. This is pediatric, neonatal, and high-risk maternal transport. What would a dispatch and coordination center look like in order to support that kind of team function? What is the medical online control that you'd actually require for that kind of a system? What are the kinds of general concepts that surround the equipment and transport vehicles that you need to use for this kind of a system, this kind of a transport system? And the team models, not getting into how are individuals prepared, but what are the potential team models that you could actually conceptualize as part of a system, and then how might you end up funding it, whether it's through provincial, interprovincial, national initiatives. And once again, just to be clear, these are a lot of these were kind of high-level conceptual discussions. We weren't getting down into the trenches and talking about a lot of details. The importance of quality improvement within system design, outreach education, because we felt that, as I'm sure everyone understands on this call, it's one thing to actually provide excellent care in the transport setting, or when the transport team actually arrives to stabilize the patient, but we want to take it a step back and actually look at our responsibility. We felt is also to ensure that referring centers are educated and supported in being able to support the next patient even better than how they've supported the patient that we're transporting right now. And so the value of that is through outreach education. Finally, one of the the cornerstones of this was what ends up being the role of families in the transport setting, because clearly we all come from a family-centered care background within child health. So what's the how do we end up taking that and actually put it into a context for transport? The importance of actually having a system, whatever system design we have, the foundation has to be policies and procedures that support it, and then obviously transport safety standards. We need to make sure that there is some basic standards that exist around patient and personnel, transport personnel safety, and what are the kind of ways that we'd end up creating those and potentially invigilate those. So those were that. We ended up putting together a document that basically captured all of those areas. But still, what we were left with is, well, where do we take this next? And the next ended up being ultimately kind of 6 months later, there was a bit of an epiphany, and the epiphany ended up being the practitioner profile group had already worked with Accreditation Canada, and we thought, okay, standards, Accreditation Canada, maybe this is the way, this is the partner that we should be looking at to actually try and create standards that would be embraced across the country for transport of these kinds of patients. And what we ended up looking at is the work that Accreditation Canada had already done in creating EMS standards. And this is the document that has been out for a number of years now. It's, for those of you who don't know what it's called, it's part of the Momentum program, and it was basically it sets standards that are part of an Accreditation Canada's site or system survey that they use to evaluate emergency medical services. Now, this is pre-hospital care. This is not interfacility care. But when we actually dug down and we looked at it, what we realized is that many of the bits and pieces, and if you end up looking at some of these standards, examples would be, if you go to 17.3 on the right-hand side of your screen, throughout the transport, the EMS team monitors the patient's condition on an ongoing basis and responds and treats the patient appropriately. We realized that there were common themes within this document that were relevant not just to EMS transport, but as well to interfacility transport. So what we ended up doing is as we realized that Accreditation Canada may be the best way for us to be able to put in place national standards for interfacility transport, we said maybe what we should do, take the EMS Momentum document, which is a wonderful standards document for pre-hospital transport, and is there a way to build off those common areas that exist between pre-hospital transport and interfacility transport and integrate it into a single document and also potentially a single accreditation program. So we put this together, which is we brought forward to a meeting last fall with Accreditation Canada, and it was recommendations for interfacility transport. And basically, I'll just fast forward a little bit here. You'll notice here, what we ended up doing is many of these standards, we copied and pasted them from the EMS Momentum document, and then we ended up editing and inserting where necessary, only where absolutely necessary, those pieces that would make this relevant to pediatric, neonatal, and high-risk maternal transport. So you'll notice that, for instance, here, 1610, there would be discussion about certain aspects of dispatch team, specialist access. We ended up editing, putting in the relevant pieces that would make people think that this is what you need for pediatric, high-risk maternal, and this is not just a general pre-hospital transport document. And that document, just to go back to it, the colors, it ultimately looks like a rainbow, but the colors ended up, the edits that we put in were very much graded, looking at neonatal, high-risk maternal, general edits. We also ended up building off a lot of really good information that existed in these standards that Kate alluded to earlier from CAMES for aeromedical transport in the U.S. And remember, this EMS commensum document was really just it was a ground transport document. So we ended up putting some edits in that would hopefully make this relevant for not just ground transport, ground interfacility transport, but for much of our country, it's air interfacility transport that we do as well for pediatrics, neonatal, and high-risk maternal. So, and what we ended up finding is the document that we'd put together in Toronto and the EMS commensum document, the headings actually really aligned themselves beautifully. So ultimately, the document that we ended up putting out along as a starting place to work with Accreditation Canada, if you look at some of these headings, these are the headings from the EMS commensum document: increasing community awareness and establishing strong partnerships, having the right people, that's actually the practitioner profile piece, preventing infections and minimizing exposure to hazards, safely operating EMS vehicles and equipment. Anyway, so many of these things were very relevant to interfacility transport. We did end up adding in what did not exist in the EMS commensum document was this piece here, partnering with families in the transport setting, family-centered care. Although it makes sense that even in an EMS document that would be important. So ultimately what we ended up doing is we brought this to a meeting with Accreditation Canada and last fall, and really the objectives of it were twofold. One of them was to actually bring Accreditation Canada up to speed with the work that we'd been doing on trying to set some create a standards document to do with our high-risk populations. But the other thing was to actually, for us to learn more directly from Accreditation Canada on what they do and what they might be able to do when it comes to helping us build standards for pediatric, neonatal, and high-risk maternal transport. It was a one-day meeting, but ultimately, by the end of that one-day meeting, there had been a lot of discussion about how we could actually maybe establish a set of minimal standards for transport. And once again, talking about standards, I guess there was also discussion about what the other steps might be that we would need for effective knowledge translation. And honestly, this is Accreditation Canada here. It's standards. The guidelines and recommendations, that might actually entail a different kind of knowledge translation. And I'll talk about that in a couple of minutes. And then ultimately, as I said, because their document had been just a ground document, there was a lot of interest from Accreditation Canada in actually having something that was relevant to ground and air, and honestly, not just for pediatrics, but actually pediatrics and adult. So it was a very valuable day that's generated a lengthy but very helpful proceedings document. And then ultimately, where we are now as of January is Accreditation Canada ended up agreeing to work with us, or actually for them to pilot a transport accreditation pilot program as early as this fall, which we were very excited about. Now we're still sorting out what the details are in terms of, is that just pediatrics, is it pediatrics and adults, but clearly this was a huge step forward in terms of Accreditation Canada saying this is more than just pre-hospital transport. We have history there. We feel it's important to be involved in establishing national standards for interfacility transport as well. And then what we've heard from Accreditation Canada, they're committed to actually go beyond this pilot program, and hopefully by early 2016 to actually have this as a consistent part of a system accreditation process that interfacility transport, when your system is evaluated, that's going to be an integral part. If that is part of what your mandate is, that Accreditation Canada would be evaluating that. And at least as part of this pilot process right now, we've got a significant presence of people from that CAPHC group that are actually going to be on the Accreditation Canada Pilot Committee, I think providing some very, very valuable inputs into what the pilot project and then ultimately what the final accreditation process will look like in 2016. So next steps. So as I said, we've got standards. We're working with Accreditation Canada on standards. But then the next question is, what else do we need? So we've talked for years about the importance of actually establishing guidelines. And I'll fast forward here in a moment to tell you that although guidelines are important, ultimately I think what we always worry about is guidelines that sit on a bookshelf that are never implemented because it's just a set of guidelines in a journal, and there's no effective knowledge translation that comes out of that. So clearly, what we need to do is we need to take it a step beyond guidelines, and we're actually working through as a group right now what the best next steps are going to be. Coming back to the original meeting that we had in 2008, I think there was a desire at that point in time for those systems that were well established to actually start sharing, what they do when it comes to transport team member education and training models. What can we do to prevent having to reinvent the wheel in every province across the country? And then ultimately, in order to be able to have effective benchmarking going forward to ensure that we're providing safe transport and we can actually do effective quality assurance, we do need to have benchmarks. For benchmarking, we need to have data. For data, ideally we need a national transport database, and this is something that we're currently discussing, and we're trying to figure out the best way to actually move forward to establishing that. So knowledge translation, this is a blank slide. And the reason it's a blank slide is because we have no preconceived notions right now as to how we're going to do this. I think we have many ideas as to how this will end up evolving. As I said, I think some of us end up feeling that guidelines themselves are not going to be adequate. We need to think beyond that, whether there end up being checklists for transport teams, what kind of tools can we end up providing, regional teams or systems to allow them to build, to be able to build a system that's going to meet an Accreditation Canada evaluation, but is also going to have a meaningful impact on how we end up transporting children, neonates, and high-risk moms. So I think this is wide open. I'd love to hear what thoughts the audience ends up having on this as well, because clearly I think there's a lot of experience within CAPHC when it comes to effective knowledge translation, and that's this is probably the most important next step that we've got. So it seems like a very fast journey, but it has been a long journey. I think going back to that first meeting we had in 2008, I hope we've actually got some tangible output now as to how this is going to move forward in a meaningful way. But as I said, we'd love to hear comments and questions from the group that might allow us to actually make sure that we take the right steps as we move forward into knowledge translation. So with that, I'll hand it back to Lisa.
Great. Thanks so much, Allan and Kate. That was wonderful. I'm just going to remind everybody you can write your questions into the pane in the control panel on your screen. I have a few questions that have come in. One from Mike. Are there Canadian standards that govern interfacility transport in adult patient populations?
Not to our knowledge.
Not to your knowledge?
Is that specifically in regards to interfacility? Is that what the question is?
Yes, Canadian standards that govern interfacility transport in adult patient populations.
Yeah, as Kate said, not that we're aware of. There are, when it comes to EMS, the EMS Commensum document is actually used as a standard in many provinces where interfacility transport is actually provided by those same providers of pre-hospital care, right? They end up adhering to the same standards, but specifically targeted in interfacility transport, no. And once again, the same kind of thing with those systems, the few systems in Canada that use CANES for aeromedical and ground accreditation. There are some standards in there, but it's not specifically Canadian, and it's not specifically interfacility.
Great. So Rachel is asking, there's an Ontario committee sponsored by the ministry that are standardizing the transport incubator. Is there still time to align with the Canadian group?
I didn't quite catch that question.
Okay, so there's an Ontario committee sponsored, I would guess, by the Ministry of Health or Transportation. I'm not sure. Health, I'm guessing. They're standardizing the transport incubator. So I think she's wondering if there's still time to align that standard incubator to the to the work that you're doing.
I would say that one of our committee members is probably a member of that, Dr. Hillary White, out of 6th. I would be surprised if she's unaware of that. Wait, Allan, do you?
Yep, and I think you're right, Kate. There's actually one of the members that's, along with Kate, are going to be serving on this Accreditation Canada pilot steering committee. Has been, as far as I know, was actively involved in that process in Ontario. I think the hope is that I think a lot of the good work that's being done in Ontario will end up forming a backbone for what may be created for national standards. I think what we have to remember though is that when it comes to equipment, for instance, when it comes to equipment standards, hopefully it's when you're talking about Ontario, it's obviously not all Metro Toronto, right? So I guess the issue ends up being, is what's created in Ontario, where it's specifically also going to be considering what's best for moving patients in incubators in Northern Ontario, is that directly relevant to high northern transport? I think it probably is. So hopefully those standards, if we're not totally in line with what's actually, from a timing standpoint, with what's coming out of Ontario, I would hope that those will still be very relevant. And those points of contact do exist between the Accreditation Canada group that's going to exist and the group that's actually working within Ontario. So hopefully those opportunities to not create separate standards will end up existing.
Great. Just a note to everybody, we apologize for the bit of the echo, the technical problems here. We have been trying to work on that and fix that, but we've had no success. So I'm sorry for that sort of inconvenience. But Hillary has responded to that to say that yes, she's actively involved with leading that process. This has to do with the incubators, and it will help us develop standards for the country. We are limited by commercially available products, and we'll be looking at levels 2 and 3. So if that helps too.
Very online.
And so Lorraine has a question. Are there recommendations for pre-hospital and/or interfacility transport of non-critical newborns with regards to securing the newborn in an ambulance?
If the question's about do they currently exist, the answer would be not in a Canadian standard. The EMS standards would address some aspects of patient safety and security in transport vehicles on ground, but not specifically as it relates to children. So that's part of the visibility that we believe is still needed in system design standards.
And I think just to build on that, I think one of the challenges that exist is Transport Canada. The standards that come out from Transport Canada are wonderful. If they're not all at 30,000-foot level, some of them may get down to the 10,000-foot level. But I think some of those details around, just tell me what I need, what's safe, what isn't safe. I think that's going to be that may not be captured through this partnership with Accreditation Canada. I think that is part of the responsibility of our group to actually move forward and create those national standards when it comes to neonatal, pediatric, and high-risk mom. So they really, in terms of detailed recommendations, they don't exist as far as we're aware. Ontario may end up coming through with something in the short term, and Hillary can speak to that by comment. But hopefully, what will happen is that whatever that knowledge translation piece is that we end up having out of the CAPHC working group, what will happen is that hopefully we'll be able to give some meaningful guidance to that at a national level.
Great. I have another question, a comment question here from Kieran. Have you looked at what the NHS has established in Britain with regards to national standards and a national database? they have looked at BC for input in their early development and have made substantial progress.
So I can speak to that a little bit. I know the UK has just in the last 10 years gone through a huge regionalization of pediatric healthcare, and as a relatively recent addition to that, people of the UK, the NHS has realized that if we're going to be regionalizing, we have to have an effective way of moving patients from point A to point B, and children from point A to point B, as opposed to them just being looked after in district hospitals. So, bottom line is that when it comes to guidelines as such that are that are kind of in the trenches, so not high-level standards, but guidelines as such, I'm unaware of anything that's actually come out of the NHS. Hillary can end up jumping in terms of comments if she's heard anything about that. I know there are some excellent teams there that are national and international leaders, but to this point in time, I know there's been sharing of experiences, sharing of resources between teams in the sense of, hey, can we learn from you what you do well? But when it comes to the NHS actually getting down to ground zero and saying this is what we end up expecting, I'm unaware of those to this point in time. But Lisa, keep on scanning Hillary's comments. She may know something I don't know.
Oh my goodness, we have a few things that just popped in here. So Hillary says, we have worked to be inclusive, to look at all guidelines in existence. We have shared well with Embrace and attend the national conference. So I'm assuming that's the NHS program. And that's from Hillary.
Great.
Yeah. So we're getting very close to the top. I don't know if Darlene or Tracy or Elaine, if you have any comments or questions yourselves.
I'll just, it's Elaine. Thanks, Lisa, just for a really quick opportunity. It really, the knowledge translation blank slide that Allan shared with us at the very end of what I want to say was an excellent presentation, Kate and Allan, I think is really, really important. And the message, perhaps, as a member of our Interfacility Transport Steering Committee, is that connecting with the Ontario work in the on incubators that has been brought to this morning's discussion, the NHS, et cetera, Transport Canada. This needs to be part of our knowledge translation strategy. The whole idea was to create national standards that set the bar, at least at a minimum, to make it more consistent, to address the diversity in current practice, to bring it up to a safe standard of care. We need to reach out and share our information and work with, around implementation, some of the other key regulatory bodies, content expert networks, etc., to ensure that sort of cross-system impact. So I think it's fair to say that that is a commitment within our knowledge translation work. If that's helpful.
And I guess it's Tracy, the question that I'll put out is, if members have comments specifically around knowledge translation, what might be the best mechanism to feed that information into this process?
That's an excellent point, Tracy. Thank you. I think really keeping it really, really simple, and that would be to have people just send a quick email to me at eorbine@caphc.org or to Doug Maynard, and the same sort of D. Maynard at caphc.org, of course, and we'll ensure that we connect the dots to our National Steering Committee, to Kate and Allan, to Accreditation Canada, to all of our partners. So let's keep that communication really simple and just reach out through email, and we'll connect the dots that way.
Perfect. Darlene, did you have anything that you wanted to add?
No, I think I'm good, other than I thank both presenters for an excellent presentation.
Sounds great. Lisa, do you think we're at wrap-up time? Just I didn't want to cut off the other.
I think we're good. It's,
okay. So, Allan and Kate, thank you very much for a fantastic presentation. Wanted to remind everybody that this presentation will be up, available for viewing. In fact, the whole teleconference, you can listen to it again if you'd like. And I also wanted to remind people that they should access the Knowledge Exchange Network on the CAPHC website. For sure, even particularly around the competency document that Kate referenced earlier. Thank you very much to you and to the working groups for their work on this complex and obviously multifaceted topic. And it's really great that we've had the opportunity to hear about it at this collaborative meeting, and also we'll have the opportunity to feed it more info as the weeks and months progress. Just a reminder that our next Patient Safety Collaborative call is on April 25th, and it's on the last Friday between 11 and 12 Eastern in most months, with a bit of a break in the summer and around the CAPHC conference. But certainly watch for the CAPHC Presents newsletter, because that will give you the information on any of the upcoming topics. And we, of course, as I mentioned earlier, always welcome suggestions about things that you think would do well in this particular forum. I know that we had over 60 lines dialing in today, and that's great across the great country. Thank you, everyone, and particular thanks to Kate and Allan for their work, and we look forward to hearing from everybody again next April 25th.